to recognize my friend from Oregon, Ms. Bonamici.
Thank you, Mr. Chairman, Ranking Member, and thank you to the witnesses. The cost of college is rising. That's clear. I hope my Republican colleagues can recognize that, as Dr. Morgan said, one of the reasons is the persistent disinvestment in higher education at the state level. My colleague from Guam mentioned something about 1982. Well, in 1980, which happened to be the year I graduated from college and started law school, 79% of the revenue for public colleges came from state and local funds. But by 2021, it had dropped to 57%. I wouldn't be here today if I didn't have the grants, loans, and work study that I got to work my way through 2 years of community college, 2 years of college, and 3 years of law school, with a very manageable amount of debt. And I'll tell you, work study was a great program. We need to enhance that. I've been working on that for a while. But we could also make a significant difference if we invested more at the federal level. It is not a lack of resources. It is a policy choice. Now, I want to talk about the H.R. 1, which I call a big ugly bill because I don't think it's beautiful. You know, I support Workforce Pell, but I want those Workforce Pell grants to be available to people who affirmatively want to go into workforce jobs, not as a backup for somebody who thinks, I really could do well in college, but I can't afford it. So first, we talked about this already in the committee. The H.R. 1 cuts Medicaid and SNAP, which is making it harder for families to pay for health care and groceries. And now states, as I know as a former state legislator, are trying to fill those gaps with their limited budgets, and students will pay the price. And yes, there's a working families tax cuts is part of the title of this hearing, but at the same time, all the other costs are going up because of chaotic tariff policies, not addressing things like affordable housing. So we're already facing those high costs for food, rent, healthcare, utility bills. But here's a point I want to emphasize. That big ugly bill gave ICE $75 billion, close to $75 billion, that's with the B dollars, and the Customs and Border Patrol almost $65 billion with the B dollars. That was a policy choice. It certainly wasn't mine. That doesn't sound so beautiful to me. In fact, it's been pretty catastrophic on many levels. I submit that if we had invested that $140 billion in education and economic development, instead we would be far better off as a nation. I want to ask you, Dr. Morgan, how does a fully funded public university system contribute to the economy and the well-being of the country?
Having a strong, robust public education system contributes not only to the ability of individuals to get ahead, but it also contributes to our communities and to states' economies as a whole. You know, our college and university system can be a driver of innovation. It can be a driver of workforce development and a way to handle kind of planning for the technological changes that are coming our way. But in fact, we're seeing the opposite in the country right now. You know, to your point, we're seeing investments in tax cuts for the wealthy, we're seeing investments in ICE, and we're ignoring these really critical parts of our infrastructure that help us prepare and build the kind of communities.
I also serve on the Science, Space, and Technology Committee, which I've been running back and forth too, and I want to say that, you know, right now, a lot of people in our institutes of higher education who are getting degrees in sciences, they're being recruited by other countries. And that's a serious concern. And we have scientists and people who come to this country to study and learn. That's a benefit for us. And we're seeing them not wanting to come right now because of cuts to research, cuts to science, and because of the terrible immigration policies that are making them feel afraid to come to this country. So I also want to talk about eliminating the Graduate Plus loan program. And establishing loan caps on professional degrees. Many prospective nurses, we've heard a lot from nurses, I know as a bipartisan co-chair of the Bipartisan Nursing Caucus, they're concerned, teachers, social workers, that they won't get the financial support they need to complete their degrees. I'm not sure if Republicans thought that this would somehow force institutions to lower their tuition when they want to implement this, but it seems implausible in light of the myriad financial pressures that they already face. So, Dr. Morgan, how does H.R. 1 affect the ability of low-income students to afford nursing, medical school, and how will this affect access to affordable health care in the long term, especially in rural and underserved areas? And how should Congress reform graduate school funding to better serve and support students rather than eliminating graduate loan program and establishing loan caps? What would be a better alternative?
This bill is going to make it much, much more expensive for people to pursue education in healthcare fields, and particularly for people who are left out of that professional degree categorization, which was a policy choice by the Trump administration to narrowly define professional degrees. So it's going to cost people a lot more money, but I think your question asks a larger question about what this means for our healthcare system. And if you look at HR 1 as a whole, it's putting our entire healthcare system at risk, right? We're making it harder for people to be insured. We're making it harder for people to be able to work in hospitals. And I think we're reaching a point where people are seeing that every time they walk into a doctor's office.
I represent a lot of rural areas as well as urban areas, and the word I've heard over and over from healthcare providers and systems like the Hospital Association is catastrophic. Thank you, Mr. Chairman. I yield back.
Thank you. I'd like now to recognize my friend from Wisconsin, Mrs. Kaufman.